A survey has found people who get their news from social media are more likely to believe misinformation about COVID-19.
That includes things like conspiracies, risk factors, and treatments. James Druckman with Northwestern University is the man behind that study. He joins us now to talk a little bit about what he found. Thanks for being with us.
Yeah, thank you for having me.
First and foremost, are there certain types of social media that are worse than others at not only spreading misinformation, but having users who believe it?
Yeah, interestingly, we found that people who are using direct messaging apps seems to have the largest effect. So people who are using WhatsApp and Facebook instant messaging seem to have the largest effect. And then kind of those types of social medias that have the direct links seem to have a larger effect than others, perhaps because people are focusing more on those messages than general going through Facebook and where there's a large quantity of saturation of information.
You also broke this down between racial and ethnic groups. Tell me who's most susceptible?
So we are finding that there's more susceptibility amongst minority groups. There are lots of different possible explanations for that. Nobody's been able to really pin down the exact reason why. So it might be due to the information environment, kind of distrust in science that goes with certain minority groups, and so on and so forth. So yeah.
So just to circle back to your first point about how you receive the information via social media is affecting how much people believe it. You said, these messaging apps like Facebook Messenger, WhatsApp, etc. Do you think people find that more believable because presumably they're getting links to these articles with misinformation from friends and family and people they know?
Yeah, I mean, our instinct is that it's less a bit about that and more a bit about how they're processing things on those media. In other words, typically if people are processing information in media where they're going to take a moment to reflect on it, which might be the case clearly if they're getting it from traditional news organizations, but even other social media outlets where they might be not as quickly going through it, they're less likely to believe it. So I think it's more about the speed of processing the information on those apps where they're going through lots of messages at once, and so they're not taking the time to reflect on a single message.
I know you also talk about the ramifications, not just for people personally, but also for us as a society.
Yeah, and so we find in the report, we found that there's a fairly strong relationship between misinformation beliefs and less likelihood to take a vaccine when a vaccine becomes available, which is obviously very concerning that if those who are misinformed are less likely to take those types of precautions, those types of measures when it becomes available, and also less likely to engage in social distancing and mask-wearing behaviors. And so there certainly are larger ramifications for the society beyond the individual misinformation itself.
What was the most outrageous thing you saw there in your study in terms of misinformation or conspiracy theories?
I think generally we asked people 11 different types of misinformation. Between 7 and 22% of people believe that generally. And the largest was belief that the COVID-19 was created in a Chinese lab, where about 22% of people believe that. And so we found that awfully concerning, given that that can have ramifications, not only for the things that I just spoke about, but also for discrimination and things that we saw quite clearly, especially in the initial phases of the pandemic.
Alrighty, James Druckman with Northwestern University. It's an interesting study. Thanks for bringing it to us.
Yeah, thank you for having me.
Certainly gives you pause about turning to social media for information.